So, bladder diary interpretation and clinical application, and especially this most of this topic will be discussed around the neurogenic bladder, how we are going to manage it, and how, what are the interpretations. Most of the things that has been covered, it is through the International Continence Society or the ICS. Link is there, and which I will share in the YouTube or in the WhatsApp group about the article on the basis of which I have prepared it, and mostly I will say it is oversimplified. The reason is oversimplified is I can understand the details, you can understand the details of the bladder, the diary, but our patients are a layman, so they may find it difficult at some point of time to manage or handle the things. So, keeping these things in my mind, I will start this bladder diary interpretation and clinical application. So, it is a low cost and a high yielding tool. Why it is a low cost? Because you don't have to pay much for that tool. It is high yielding, and also there is no copyright issue with it. So, there are three components which you have to keep in mind while prescribing a bladder diary. First thing is the timing, second is the fluid intake, and the third is the fluid output or the urine output which you can. This is from a chart that is I'm showing it. It is mainly from the ICS guideline and the questionnaire that was there, on the basis of which it was prepared, and it was done in 1998. So patient will write its name, timing every 6 a.m., 7 a.m., when whatever, what is the amount of drink he or she is taking, it is a type of urine he or she is taking, and the urine output that is coming out, and the bladder sensation and the pads. Why this bladder sensation and pad is important? Because this was mainly made for a generalized perception. Generalized, it can be used by every section of the society, or anyone with any type of pathology, including the diabetes mellitus to diabetes insipidus to the Parkinsonism, or any overactive bladder, underactive bladder, or any other things. So, for the patients, especially the spinal cord injury patients with complete injuries, this bladder sensation does not make much of sense. But this bladder sensation becomes very important if the injury is incomplete. Always remember, the injury is incomplete, then you will find out, check with the patient after how much time of taking the fluid intake and a specific amount he feels the bladder sensation, first thing, and the time at which he feels the bladder sensation, when does he goes and pees, or he feels that he should pass. So bladder sensation helps you in understanding about the urgency, especially in the patients with incomplete spinal cord injury or the brain injury. In patients with the brain injury, remember, they have intact sensations. Most of them has intact sensation, and so those intact sensations helps them realize that when they are going to have it. Of course, the cognition matters, and if patient has a good cognition, you will find the patient is giving a good bladder sensation. So, if a patient is on brain injury patient is there, does he or she needs it? Yes, definitely he or she needs it, because the moment you take out the Foley's catheter, this urgency will be increased, which may take 2 to 3 days to settle down. Now, when I am saying 2 to 3 days, because bladder may get shrunken, and some biofilms are formed, and all this to get out and come out, all the slough to come out, may take 2 to 3 days. It is always advisable to have asked the patient to have a bladder diary mainly for 3 days. 2 to 3 days is a minimum. 72 hours, according to the ICS, is the need for the patients. So 372 hours, definitely yes, you should go ahead. What is the significance of these pads? Pads are significant, especially in all types of patients, especially if the patient is of a had some sensation. And what happens if the patient sometimes leaks in the at some point of time, and even if it is a complete injury, they leak at midnight, and when they wake up in the morning, they find that the pad is wet. At that point of time, pads become important, because the weight of the pad, in change in weight of the pad, will determine the amount of urine output. This urine output is decided by the weight of the pad. So pad measurement again is an important component. Whether it is a patient has a bladder sensation or absence of sensation, complete injury or incomplete injury, so weight of the pads always determine it. So keep this thing in mind. Suppose now the question is asked, you can ask this question come to your mind. Suppose a patient is a complete injury and he is having leak every 2 to 3 hours. His in a whole night his pads will be wet. So if his pads are wet, how we will come to know when did he pass? No, it is a very difficult and tricky things to determine. That point of time you have to make sure, talk about the how much fluid intake he is taking, whether it is a nocturnal polyuria or a daytime. So in that point time you can you have some idea with it, with the calculating the total amount of the day output compared to the night output of the urine. So this will help you in finding out the bladder components or bladder things are there. Another important thing is that if pads are not there, if the patient is having leak, when he has the leak, that is also important. Why when he is having leak is important is because what time he took the water and what time this leak is there. At that point of time you will have a gross idea. I'm using the word gross idea about the bladder volume as well. When I'm saying bladder volume as well, that the urine output is, suppose the patient is took some water at around 6 a.m., does the CIC, and then the urine output is around 200 ml within 2 hours. So you will have gross idea, okay, 200 ml in 2 hours is his bladder capacity, and then you have to manage the fluid intake accordingly, because fluid intake will decide about the urine output. First thing. Second thing is that it is not the only the fluid intake that will decide the output. It is also the type of fluid one takes. Suppose someone is taking caffeine, alcohol, or some diuretics, the urine output will definitely increase. So that has to be kept in mind, and accordingly you have to do the permutation and combination accordingly. So this is an important part. Another important point is always remember the urine output is multifactorial. When I'm saying multifactorial, suppose our patient is a spinal cord injury patient or any patient with a severe constipation, his bladder capacity will automatically decrease. So if he passes the motion well, you have to make sure to get a good bladder rehabilitation. Bowel rehabilitation is simultaneously important, which I discussed in the last class as well. So that point of time you have to make sure that this bladder is empty, what time patient is getting up, and how much he is drinking. If he is drinking at some point of time, you will find that patient is saying I drank only 2 liters of water, but still urine output is more than 2 liters. There are quite possibilities. First, patient is on some diuretic medication, or or patient is taking some caffeine, and or the patient has some pituitary problem, brain injury with the involvement of pituitary definitely, and there's a chance a patient may have diabetes insipidus. So keep this thing in mind. So whenever you are doing, another thing is that, so suppose for I'm sitting in Patna, the temperature in Patna today was around 41 42 degrees centigrade. So urine output, if I'm sweating a lot, and then the urine output will automatically come down. So keep the climate, weather, and all everything in mind when you are describing. Suppose someone is in the Kashmir area or the hilly area where the temperature is comparatively better, weather is better, the urine output will not be much affected by the climate. So everything, permutation, combination has to be kept in mind, especially in a weather like I am in Patna, where there is extreme of hot weather, and summer is at its extreme. It may the temperature may go up to 45 46 degrees centigrade in some in the month of May and June. So the bladder diary will be quite different. When in the same Patna, if you come in December, January, when temperature is around 15 degrees centigrade, the bladder diary will be different. So there will be a seasonal variation. So wherever you are practicing, you have to keep the season, output, the factors which affect the urine output in mind while reading the bladder diary. So now, this is, if you look, this is a slight piece of paper which in any developed country or place people will distribute among the patients with a good primary caretaker. But our system, where patients with a spinal cord injury may find it difficult. This is a self-made, which I do prescribe. It is practically, you may find some practically it is really good and helpful for the patient, but it may not look a typical bladder diary which you see in the books. But for all practical purpose, this will be more than enough, which especially with the patients which we are doing, which needs the neuro rehabilitation at that of point. For example, this is a date, write it, ask the patient to buy a small notebook, and it must have a 2 page and with a hard cover, and the back must be hard. Why I am asking the hard cover? Because if the patient is sitting there, patient is a paralyzed patient, then they need something hard to, they have to balance their body while writing, and they will sit and write on the paper, getting every hour this table on the bed and all is practically not possible. So practically things will be there that you write it. For example, take for example, some point of time we have to sign a discharge summary while standing or while in the ward and the patient is behind you, and between in between rounds you have to do some signature work. This paper you find it difficult, then you have to take help of the wall to sign it, but our patients cannot do it. So have a hard cover notebook and ask the patient to write in the 2 pages. First is the date, second is the time, another is the fluid type, and the fluid in ml, urine in ml, leaks, and the remarks. Why remarks becomes important is more, our patients may have some sediments, at the patient may say that pad was wet, he does not know when it was wet and all. So that calculation always needs to be added with the urine output, and if there are sediments, you need to find out the cause for these sediments. One of the common causes for these sediments in the urine is of course the UTI in a while patient undergoing neuro rehabilitation. So the simple thing is ask the patient to write a time whenever something related to fluid intake or output. So if something is happening, just write the time over there. For example, if patient has the time is around 6 a.m., he wakes up and has have some water, and he writes it that he took 100 ml of water. Okay, so how patient will find whether it is a 100 ml or 200 ml, or it is a gross idea which patient will need. And this gross idea of the 100 ml or 200 ml, initially what you can do is you can give an ounce glass, or there are a lot of glasses nowadays coming up with a mug with a marking over there. So approximate ideas will be definitely helpful. So for example, patient took water at about 100 ml. So ask the fluid type, make sure, because most of our patients, if you don't communicate properly, they will think water is the only fluid in our society. So make sure that they're adding everything, even a cup of tea, even lassi, even chash, whatever fluid they are taking, soup, rasam, whatever they are taking, it must be added over there. So around 6:30 a.m., suppose patient voided something around 150 ml, there was no leak. Suppose patient says that he had a leak at around 9 a.m., just ask him to make a tick mark and write it down. So similarly, if the patient follows this, for 24 hours you have to calculate the total fluid intake, and then you have to calculate the total urine output. Now why it is important, total calculation is also important in 24 hours, because if the patient is doing CIC, then you have to make sure that CIC is done every 4 hours, but practically you will find it difficult for the patient to do it. And the fluid intake has to be around 2 liters, 1.5 to 2 liters, or even less, because even less is important because the volume, the bladder capacity is also determined by it. If the patient is taking too much of water, then the urine output will be too much, and then leaks will be too much. So 1.5 to 2 liters is a safer side, but that needs to be adjusted as per the urine output, keeping urine output, leak, and sediments in mind. Why sediments in mind? Because sediments may be an irritant, and if there are a lot of sediments coming out, definitely it needs to be evaluated. Pad or wet diaper, if what is the weight of it. So always remember this. Suppose a patient comes to you and urine output you find it is around 2.5 liters, and the fluid intake is around 3 liters, then that has to be kept in mind. This bladder diary. This is the basic thing. You can read everything, you can find out everything, and you can calculate accordingly. Then again, important thing is to look out whether there is a nocturnal more, or in the daytime it is more, because daytime always urine output can be less. Another reason can be the physical activity. If there is a lot of physical activity, then urine output will be definitely less. So, what are the things that can be interpreted through a bladder diary? You have to only understand the design patterns, not one value. One value never, never, never. It may be misleading at one point of time. Patient may be confused. It can be he may be writing something to for your sake. You have to counsel it, or that day patient took a lot of fluid, then it may change. So 72 hours important pattern you have to decide. Pattern is how frequently patient is having, and what about the nocturia analysis? Although we say patient to do it every 4 hours, every 4 hours CIC, you will find that most of the patients don't follow this 4 hour principle in the night time. Slowly they will adjust themselves to 6 hours or 7 hours while going to bed, coming out of bed, they will do it. So what, that is an important thing. Voided volume, what is the amount of the volume that is coming out? That is really important, because the volume and intake, whatever is the balance, that is has to be kept in mind. If someone is passing too much of fluid, then diabetes and all this, and how fluid intake pattern is also important. When patient took the fluid, what is the time, how much is taking at one time? Suppose patient may take a fluid around 300 to 400 ml at a time, and he may, after immediately within 2 hours, it will increase. So especially in the patients with the spinal cord injury, what I suggest is to have it around 100 ml to 150 ml at the most maximum. So control it, do it, don't take it too frequently. You, if you are feeling too much of thirst or drying of lips and all these things are there, have sips of water, apply some jelly, Vaseline jelly or anything around the lips, and all these things, small things that can be done. And if the continence is there, when it is the most, what activity patient is doing, whether it was at the time of coughing, what happened during the continence, these things can be read all through from the bladder diary. So what are the diary findings that will lead to your finding in the diagnosis? So the most important is, if there is frequent small voids are coming out, overactive air bladder, or urine output fluctuations, cough or exertion, or during the exercise or while putting some pressure on the abdomen, stress urinary incontinence, or there is a possibility of element type of the bladder, large total urine volume, 3 liters per day, polyuria, it can be in the brain injury patients. Be careful, look out for the drug history, uh, ADH and all these things has to be there, pituitary hormone and all. Night urine more than 33% of the total. If it is there, nocturnal polyuria can be diagnosed. So, what are the clinical applications of the bladder diary? It is a diagnostic tool, first and foremost thing, and it will help you plan your treatment accordingly. Where I'm saying a planning your treatment accordingly, it includes, as a rehab physician, it includes the patient's occupation as well. Suppose your patient has to go to some working in a desk job in a corporate office where the air condition is all air conditioned, he may need to go in. So accordingly, you have to advise him that adjust your fluid intake, look into it, the temperature, how to keep yourself warm, and all these things will definitely matter. It will help you treatment planning. So treatment planning for a rehab physician is not just few medicine. Yes, do medicines include, for example, medications. If our patient is showing overactive bladder, oxybutynin, how much to give, dose of oxybutynin will definitely depend on the bladder diary, or any other treatment plan. Treatment is as a holistic if you are looking into it. So another thing is, if you have given some medication, we have prescribed some, for example, oxybutynin, and then we have to look after a week or so, how is the bladder diary again, and compare accordingly the urine output, bladder frequency, everything has to be there. So there are three clinical, it helps you diagnose, it helps you treat, and also the monitoring of your treatment response. So there are all applications has to be there in your mind to plan from the bladder diary. So but if there is a bladder diary or any tool, there will be always a pitfall. Nothing is perfect in this world. So pitfalls will be incomplete diary entries where you're counseling with the patient why you need to understand the importance. Patient may find it is just a number, but for you it is all your treatment plan. So incomplete diary entries, patient may forget in the night and may write something in the daytime. So all these things has to be managed, including the pad weight, weighing the pad daily may be cumbersome. So you have to teach them the importance of everything and get it done. And misinterpretation of fluid intake, as I told you, fluid maybe water, it includes milk, it includes lassi, chaach, everything. It includes tea as well, coffee as well. All these things has to be there. So misinterpretation of the fluid intake should not be there and may not count that okay, I took rasam today, I took a lot of dal today. So everything is a liquid. You have to keep in mind while deciding how much dal he is taking, how much rasam he is taking. That becomes important. And comorbidities like diabetes or congestive heart failure and all these things become important. Another one important thing about the bladder diary is maintenance is the patients with Parkinsonism. Whenever they are doing activities, it will increase. Nighttime writing managing the bladder diary for the Parkinson patient is a bit difficult because that every time they will go for activities, they will find it troublesome. Most of the medication that is given for Parkinsonism is in the daytime and to control the tremors in the daytime. So these things has to be there in mind. So patient may try to remember it. Some 60, 70-year-old gentleman may have some dementia. In the morning, he will forget to write it. So all pitfalls has to be managed and accordingly. It all depends on your communication skill, your clinical skill, your clinical acumen, and your understanding about the bladder diary. So take OPD message is a simple tool. It is a high diagnostic yield pattern recognition, which is isolated values, and it guides both the diagnosis and management. And it is essential before labeling someone as overactive bladder or underactive bladder or anything. Okay. On the right side, it is the my clinic, probably the first ever physiatrist to have a complete private setup, not associated with any system. So if there is any question, do let me know. I will be more than happy to reply, and we have limited time, only 10 minutes of time. Okay.